Hello my beautiful friends and welcome to fibamu. I'm Inga, physiotherapist, and in today's video we'll have a look at sciatica. Together we will have a look at what sciatica actually is, the anatomy of it, the causes and also the symptoms, and then I'll show you some simple tests for you to differentiate where your sciatic nerve pain could be coming from. Then we'll finish off with some exercises to give you some immediate pain relief. So let's get into it. So what is sciatica? Sciatica is not a diagnosis, but it's a symptom. Sciatica is some pain and numbness, maybe a tingling or burning sensation that typically starts in your lower back region, travels down your buttock area and into your lower leg. And it often indicates some irritation of the sciatic nerve. The sciatic nerve is easily the largest nerve in the human body. In some areas, it can be easily as thick as 2 centimeters. It starts in your lower back where the nerve roots of L4, L5, S1, S2 and S3 come together. It runs through your pelvis, passing the piriformis muscle, which we'll come back to later, and then runs down in the back of your leg. It innervates your hamstring musculature and most of the muscles of your lower leg. So it's important to keep that in mind. If you have a problem in your lower back, it can even present as a problem or issue with your foot, for example. Now let's have a look together at the causes. We usually differentiate between spinal causes and non-spinal causes. With spinal causes, we have usually our disc herniation or disc bulge that often leads to a lumbar nerve impingement or compression. Then we also have the non-spinal causes, which could be the Piriformis syndrome or wallet sciatica, or also often during pregnancy, the fetus is pushing on the sciatic nerve and sciatica might be presented. I do want to highlight here though that approximately 90% of sciatic nerve pain comes from the spinal causes, so often from a disc herniation, for example. So what causes your sciatic nerve pain? So the sensation that you're feeling of this numbness, this tingling, or this burning sensation down one leg is actually often caused by an irritation of the sciatic nerve. This compression on the sciatic nerve can be due to, for example, the herniated disc or the disc bulge, or also a muscle like the piriformis muscle pressing onto the sciatic nerve and leading to these symptoms. The symptoms often might get worse with flexion of the lumbar spine or when you try to turn and twist, sometimes when you cough. And the reason for that is that you already have probably quite some pressure on the sciatic nerve. So if you bend, for example, forward, the disc will do the same and the bulge will basically increase in the back, increasing the amount of pressure on your sciatic nerve. So let's get into our tests to differentiate if your pain is coming from your back or maybe from the piriformis. So our first test is a slump test. It shows us if there is a nerve root entrapment or a disc herniation. For the test, please find a seat on a chair or on the edge of your bed. Come forward, your hips are parallel, and I want you to take your hands behind your back and then come into a flexed position with your spine. So your thoracic spine and your lumbar spine, you just basically bend forward. Your head stays with the gaze forward. And maybe this is already recreating some of your symptoms. If that's the case and your affected leg is showing an increase of that pain, stop here. If this is not the case yet, we can go to the next step and you're gonna come with your chin towards your chest. Basically bringing even more tension onto your spine and your nerves, okay? Again, if this is recreating the symptoms, stop here. If not, the next step is to lift up your affected leg. So bring your knee straight. Again, if this is recreating the symptoms, stop here. If not, the last step is to dorsiflex. So bring the toes towards your nose. Flex them too, okay? And release, come out of the position. So as I said, a positive sign of the test is the recreation of your symptoms. And if the limitation is, for example, coming from flexibility of your hamstrings, this is not a positive test. This is a whole different problem. So we are looking for these nerve tingling sensations that you usually feel with your sciatica. If the previous test was negative and you couldn't reproduce your symptoms, it might also come from your piriformis muscle. Remember, the sciatic nerve runs beneath the piriformis muscle. What sometimes happens is that the piriformis muscle is so tight, putting pressure on your nerve, and this could also lead to the symptoms that you're experiencing. So to test the piriformis muscle, please come on your back. And we test both sides. So you can start with your left leg, bring your left knee towards your right shoulder. This way, we're putting load and stretch on your piriformis muscle, and you're looking for an increase in symptoms or an increase in pain, and like a restriction, maybe you can't even go that far. And really important to compare, to test the other side and see if you have a difference in mobility or in tightness. Okay? Very good. Now I'm going to show you already our 3 quick exercises. We start with exercises for the spinal causes. Please make sure to grab yourself two pillows or a blanket that you can roll up. So you want to take the pillows. So if you remember from earlier, there might be too much pressure on your nerve from your bulge or herniated disc. What we want to do is we want to bring it the opposite way. So away from the flexion position. So you're putting your pillows on the mat and you're just gonna lay over them, okay? So you place your hips onto them and then you just come and rest on your forehead and relax here for as long as you like. This should really make the pain travel out of your leg upwards towards the source of pain, okay? You just rest here for as long as you like and wait for the symptoms to slowly go away, okay? Maybe at some point you don't need 2 pillows anymore, so you remove one, you stay here, and this could, for example, also be a great position to sleep in. For the second exercise, you can remove the pillow, you stay on your stomach, and we're going to do little Cobra press-ups. You're basically lifting up your upper body just as much as you're comfortable with. You come back down, and you push up again. Back down slowly, and this you repeat a couple of times. Again, we are looking for the pain to travel back to its source. So it's slowly leaving. And this one actually often works pretty well. So have a look if it hopefully works for you as well. Very good. Now I show you a second sleeping position just because we're already on our stomach. That often helps people if they have pain from the piriformis. You would take your affected leg and just bring it a little bit upwards, and you can sleep like that. That way the piriformis is in a slack position and not putting pressure on your nerve, okay? But now to the exercise. For that one, please come on your back. Maybe you are already familiar with the figure 4 stretch. If not, you take your affected leg and put your heel onto the opposite knee. Then you bring the knee in towards your chest, paying attention that the knee is not coming towards you, so you're pressing it away, and that should really fire up the piriformis muscle. You should feel a nice stretch. You can stay here for as long as you like, and if this is not enough for you, you can also take the left knee or the knee that is up and bring it over to the opposite side. That should also really give you a nice stretch. You can stay here for maybe 10 to 15 seconds and then come back to the middle, okay? Very good, that's it. You can come back into a seated position. Very well done. I hope you enjoyed this video. I hope it was helpful for you. If it was, don't forget to give us a thumbs up, subscribe to our channel, and have a look out for more videos about sciatic pain, since we are currently working on some nerve mobilization techniques as well as some other exciting projects, okay? So until then, I hope you have a wonderful day and see you here again soon.